Go ahead.
Good afternoon, my name is Cindy, and today I will be informing you about a defect in the heart called bicuspid aortic valve. I chose this topic to talk about today because my brother has it, and I will talk about what it is and different things that affect the valve, and also two replacement choices. I will also tell a couple stories I've seen firsthand. There are 4 valves in the heart, but the aortic valve is the most important. It flows blood into the aorta, which is the body's main artery, and to the rest of the body. Bicuspid aortic valve is the most common heart defect, about 1.3% worldwide. It occurs when the aortic valve is formed with 2 cusps instead of normal 3. Some valves present with stenosis and others with regurgitation. Even though they both only have 2 cusps instead of the normal 3 in common, they are completely different. Stenosis is when a valve doesn't open the way it should, not allowing enough blood flow into the heart, and regurgitation is the opposite, where it doesn't close the way it should and the valve leaks, making blood flow backward into the heart. If the valve needs to be replaced, it could be done through surgery or using a transcatheter, also known as TAVR. People with severe stenosis are usually the one that receive TAVR, but according to Southern Thoracic Surgical Association, TAVR patients had a lot more complications after the procedure than people who got the surgery. And with surgery, there is a longer hospital stay than with TAVR. Now that you've known more about that, I would like to talk about my brother's journey through this condition. When my brother was 11 months old, he went to the doctors for a stomach flu. They heard a murmur in his heartbeat. A specialist then diagnosed him with both valve stenosis and regurgitation. Growing up, he couldn't participate in activities kids his age could do, such as sports and going on roller coasters. He had to check his heart every year. One year they found that his ejection fraction, which is the amount of blood pumped out of the heart, was low. So at the age of 16, he needed open heart surgery. They replaced his valve with a pig valve, and then that lasted about 6 years. July 5th, 2022, at 9 in the morning, my brother called my mom saying he needed a ride to the emergency room because he was coughing up blood. The doctors told us that he was having a heart attack at 22 years old and partially due to COVID. They rushed him to the ICU where they were giving him oxygen through a mask, and 14 hours later they finally intubated him. Eventually they had a fly machine in to keep him alive, and later that night he got flown out to Mayo Clinic. They put in a new pig valve using the transcatheter that went up his leg to replace it. The apex of his heart is completely dead, and as of right now he's okay. Valve is hereditary. August 12, 2025, my nephew was born with the same defect my brother has. They're hoping he can live a life without needing surgery. I hope you enjoyed a little bit of my family's history with Valve. Thank you for listening.